Ms. Craig, 5 minutes.
Thank you, Mr. Chairman, and thank you for your resilience here today, Mr. Secretary. More Americans have health care today than ever before, thanks to the ACA. And the expansion of those tax credits included in the Inflation Reduction Act. Enrollment and coverage through the ACA marketplace is at an all-time high, and a record high of 21.4 million Americans are now enrolled in coverage. In fact, in my home state of Minnesota, the uninsured rate has been cut in half compared to 10 years ago. On that note, Secretary Becerra, can you talk a little bit more about how the subsidy expansions included in the IRA are helping lower health care costs for families?
Thank you, Congresswoman. I think it's pretty obvious when people recognize that so much of the cost of health care occurs because people who don't have health insurance use the emergency room, the most expensive place to try to get health care. It ends up costing all of us money. It's also, when you think about it, the emergency room, it's the last resort. So someone is waiting till they're so sick, so bad, that they have to use an ER. Having your own insurance means that you don't have to wait. You can actually go see a physician ahead of time. And so we're saving billions of dollars by making sure people go early for their care and don't wait till they're so sick that now taxpayers have to cover the load.
Thank you so much. It's really heartening to know that the policies that we've championed and I've been part of voting for are delivering real savings to American families. Thanks to the IRA, millions of families have seen the cost of their monthly insurance premiums go down, and the average family is saving $2,400 in premiums a year. This budget includes a proposal to make those expansions permanent. Can you briefly discuss the importance of making the tax credit enhancements permanent?
You know, there's always someone who's right on the edge. They qualify for Affordable Care Act coverage in the marketplace to get a really good insurance plan, but all of a sudden they're lucky, they get a bit of a wage increase. All of a sudden they no longer qualify, and the burden of having to cover the entire cost without any subsidies becomes too much. By making these subsidies permanent, what we're doing is making sure that a lot of Americans who aren't rich, but they're not poor that they qualify for Medicaid, are able to sustain that coverage for themselves and their families. And so it's a way to make sure we are healthy from the beginning.
Mr. Secretary, I can just say to you that one of the reasons I ran for Congress is because I wanted to sustain the ACA. I grew up in a family myself without access to health care coverage for much of my childhood. And, you know, I know my colleagues talked earlier today about cost of living across this country, but I'm proud of the reforms, especially in the last 6 years when it comes to health care, because we have lowered the cost of living for so many Americans, not just with the ACA, but also in capping insulin at $35 a month copay, which I was proud to lead that bill here in the House. I want to slip in one more question before I yield here. I'd like to turn to an issue that's been really top of mind for me in this Congress, and frankly, one that I don't think this body and its members and a number of administrations have paid enough attention to, and that's the fentanyl crisis, the opioid crisis in our country. With every step that we make toward preventing more deaths, it seems that the dark underbelly of the illicit drug market churns out new poisons 100-fold. I was very pleased to see President Biden sign my bipartisan bill, the End Fentanyl Act, into law last month. That legislation requires Customs and Border Protection to update its manuals at least every 3 years in order to identify new ways to prevent drug and human smuggling through those ports of entries. It's a critical step in the right direction, and I'm interested to know how our public health agencies are working to improve outcomes in concert with law enforcement. So, Mr. Secretary, in 30 seconds, how does the President's budget proposal support HHS with respect to these issues?
Well, I won't speak to the close to $45 billion that the President devotes for enforcement, especially at the border. I'll speak to the close to $9 billion that the President has in his budget to try to tackle opioid overdose and all the effects, which would include what fentanyl does. There is a particular program which I know your state and every state of every member here takes up, and that is the state opioid response grants That is money that we give out to states so they can directly target that opioid abuse. Fentanyl is part of that. We also have a drug prevention strategy that makes sure that the best practices that are evidence-based are used, and so we invest in those. We're doing everything we can. $1.6 billion is allocated for those state opioid response grants. Another $1.5 billion is provided for SAMHSA to provide behavioral health services to help address opioid and substance use issues. So we're trying to make the right investments we can with our states.
Thank you so much, Mr. Chairman. With that, I'm out of time, and I yield back.
Gentlelady yields back. More overutilization of the ER is done by Medicaid patients than the uninsured statistically. So